be a brother's keeper.
They say the use of excessive alcohol, drugs, substances, caffeine, among others, to cope with the current situation should be discouraged among Nigerians. While preferring some possible ways to get out of the quagmire, they urge the federal government to revisit some of its policies or seek public opinion on the issues on ground.
The government should open doors, the industries, like they promised us refineries coming since we have not seen. Open up industries. The emphasis on agriculture. Government should buy more land, modernize the agricultural produce, and let boys, young adults go into farming.
According to them, the causes of mental health, anxiety disorder, and depression were on the increase in recent times. They however called on government at all levels to be sensitive over the suffering that Nigerians were going through and to do the needful before it gets out of hand.
Sodium is an essential nutrient for maintenance of body plasma volume, acid-base balance, transmission of nerve impulse, and normal cell function. However, the dietary sodium consumption, which is dependent on cultural and dietary habits of citizens, has led to overconsumption. The WHO recommends a reduction of intake of sodium by 30% by year 2025, but current findings reveal that an average adult consumes more sodium per day, which is higher than the WHO recommendation. This Abuja meeting of the Federal Ministry of Health and Social Welfare, together with development partners, is targeted at formulating policies and reviewing national strategies with the aim of creating a conducive environment for citizens to consume adequate quantities of safe, nutritious foods with appropriate salt content and improved dietary habits.
Many people don't understand the dangers of excessive salt, so we really have to create a lot of awareness. If we join forces together, just like we're going to be doing in this technical working group, join forces and bring up policies, and we have the willpower to enforce them.
You see it even in the cubes, what is constantly called, the seasoning cubes we use in our food, the salt intakes, adding salt into the food that we take. There's already a limit, and we're hoping with the technical working group we can begin to discuss how to take forward any guidelines that have been established, the minimum standards or the maximum limits anyway.
The Permanent Secretary, Federal Ministry of Health and Social Welfare, agreed that reducing salt intake is one of the most effective measures to improve health and minimize the burden of non-communicable diseases.
The reduction technical working group today, we expect the TWG to be efficient, productive, and impactful in the development of the National Sodium Reduction Guideline that will provide an overarching guidance for the implementation of the WHO SHAKE project on salt intake reduction in the country in order to meet the set targets of year 2025 deadline.
The technical working group has been mandated to ensure that industries, small and medium-sized food product enterprises and local food vendors are closely monitored and sensitized to ensure compliance with clearly defined national food safety standards.
A little bit from our mothers, from our friends, and from the experts on how you should take care of your teeth. Do not go anywhere. What does today mean to you on the health calendar?
Today is World Oral Health Day, which means the whole world is celebrating oral health. The whole world is talking about oral health simultaneously. All the countries in the world are talking oral health today. Not only talking, they are going to raise awareness in different locations.
I'd like to understand, when it comes to rural communities that, some of them use chewing sticks still. How are you able to advocate or sensitize them to adopt modern ways to improve oral health?
Well, what we advocate is to use toothpaste and toothbrush. The toothpaste must contain fluoride in it. That is what we advocate. But you are in Nigeria, you know the cost of things. Before, toothpaste used to be like 150 to 100, but now toothpaste is like 1,500, even 2,000. to get a tube of toothpaste.
That's correct.
So, in rural areas where some people cannot buy this toothpaste, they use chewing stick. Yeah, but the only thing is that they must know how to use it, because some people will use it and be scrubbing and be even
actually hurt themselves.
Yes, and damage their gums. That will be another problem. Yes, so that is what we use this period to do.
What does World Oral Health Day mean to you?
Well, to me, it is actually an advocacy day to sensitize, the public on the importance of, oral hygiene. As we've been told, and people should know, our health is an index of our oral hygiene, oral dental hygiene, amongst many other factors that you can, consider. It's not all about the food or exercise or this and that, but dental oral hygiene is really very important. So this day is actually a day to really sensitize, the public in terms of advocacy.
Our beautiful, lovely children, with passion as a mother, I like to make a call to you to understand that your breath, the way you talk to others, how people relate with you is very, very important. When you open your mouth, everyone wants to see it, smell nice. Just like the close-up, Pepsodent advert, when you see somebody, a lady, talking to a guy, and the boy, the odor wasn't too pleasant. She was treated. So for you as children, please ensure that you take it upon yourself to clean your mouth. At what age do you think it's important, and what have you done with your own children?
There's an adage that said, as you lay your bed, so you sleep. Teach a child what you have and you will grow up with it. So it is better to teach them when they are infant. When they are growing, you teach them that they have to brush their teeth, they have to keep their teeth clean.
I hope you enjoyed that one. We're going to be looking at some myths when it comes to oral hygiene, what you should do and what you should not do. Welcome right back. Just like I said, we'll be speaking to the expert and those particularly catered to oral health, no other than a dentist. So stay tuned as I bring you this interview and more. To understand, during Christmas, there's Santa Claus. During Easter, there's the Easter Bunny. Now it's World Oral Health Day, and you are a dentist with a dental experience. Tell me what this day means to you as a person in your profession.
Right, so as a dentist, I would say World Oral Health Day comes for us as a very big day, very important. Just as you said, Christmas is for Santa Claus, the Easter is for the Easter Bunny. And World Oral Health Day, of course, beyond the patients, is now the time for the dentist to really showcase what exactly we are out to do. Well, many people see dentists as those evil guys who are just out to pull out your teeth and, to restructure your faces. However, beyond that, our prerogative is to see a society with healthy teeth. And in a day like this, particularly for some of us in the developing world, I would say our focus is on how to drive down the incidence of new diseases, how to drive up awareness, knowing that a good majority of oral health burdens can actually be prevented.
Well, that's That's quite interesting. Thank you so much. So I've spoken to a few professionals in the field of medicine, and a lot of them actually gave some interesting points about the fact that oral hygiene is connected to so many other parts of your body in terms of your organs. That's quite interesting. So I'd like to look at a particular area. In the area of pregnancy, how does oral hygiene, fit in, and what role does it play to ensure, a safe set of trimesters?
Okay, so I'll start by saying in Nigeria we have a strange belief. I've met several women who tell me with each child comes a loss of a tooth. Well, this is not particularly true. However, during pregnancy, something happens. There's a lot of changes in the body of the woman or the woman, and these hormonal changes also affect the oral health. You have people with poor oral hygiene. In this case, the problems become augmented or increased because of pregnancy or because of the hormones that increases in them during pregnancy. Take for instance, somebody with a very poor oral hygiene can come up with something we call pyogenic granuloma, which is basically a swelling around the gum that bleeds easily and that comes out looking foreign. Now, many people see that and immediately assume, oh, maybe I have cancer. Some people link that directly to pregnancy. Of course it is. However, pregnancy isn't the cause of it. Rather, poor oral hygiene is the cause. However, the hormones brings it out. Now, on the other hand, during the time of pregnancy, it is paramount for the woman to maintain a good oral hygiene for the baby within, because there are so many studies that have shown that has proven that poor oral hygiene leading to periodontal diseases, that's basically the gum disease, can lead to premature birth in children, and then you can also have children with low birth weights. That means they are smaller than they should naturally be. In the third trimester, when you have very serious procedures, overly serious procedures done in the clinic, you are afraid that you may provoke spontaneous delivery before time. So we're careful, and then in cases like this we prefer to manage until after birth, before before the woman is treated. In the first trimester also, of course, there is a fear of the x-ray rays, the rays of the x-ray machine, which may affect the child. However, we have come to, studies have shown that protecting with the lead, what we call the lead jacket, which prevents rays from penetrating the deeper tissues, can actually protect the baby within. So in that case, it is not as, it is not as sacred as it used to be in the past. In more recent times, we realize women can actually come and should actually attend should have a dental visit in their first trimester of pregnancy. A very important, advice for new mothers would be to ensure not to prevent something we call the baby bottle, the feeding bottle and cavities, or feeding bottle caries. Now, feeding bottle caries, when you see some children, unfortunately, you look at their front teeth and they look really bad. They look destroyed. Now, what causes that is because many parents, to make the baby happy, maybe because they cry a lot and to calm them, they end up leaving them with feeding bottles with sugary fluid in it as to sleep on. So they go to bed with a feeding bottle in the mouth with sweetened milk or sweetened juice or any sweetened drink. Now, what happens is the bacteria in the mouth, once they recognize sugars, they get active and then they become dangerous to the teeth. So they start attacking the teeth from that instance. When that happens, the child does it as a habit. It starts destroying the surfaces of the teeth, which are most unlikely to actually have cavities. But because the sugar is resting on them day in and day out to keep baby calm, then we end up having things like that. Now, the unfortunate thing with this is when the baby comes down with what we call the feeding bottle caries, or feeding bottle cavities or decay, the teeth are supposed to be in the mouth till they are about 6 years old. And when they are destroyed, it means you might have a child growing up already with some psychological regression, because they don't want to expose themselves. They don't want to smile because they feel their smile is ugly. You see friends and family always asking the child, oh, what is wrong with your teeth? Why do they look this way? And then you have a child who is withdrawn. So oral health, as you can see, can actually affect almost every aspect, or should I say every aspect of health, from the systemic health in terms of your organs, diabetic patients, cardiovascular diseases, and even up to mental health, which can change how a child sees the world even before they are old enough to know
turn their output to the world.
Exactly.
Quite interesting. Still dealing with children before we get to the adult. When it comes to kids, are there special toothbrushes for them once they develop their teeth, and how many teeth should they have before you transit from the I think the clot, I forget the name, from the clot to the toothbrush.
The time the child's first tooth appears, they should actually start transiting into the toothbrush. There are special toothbrushes for babies, age-appropriate toothbrushes, which would not cause damage to the child's gum, because of course you wouldn't use what you're using for your baby.
Yes.
And there are also what we call training brushes that appear sometimes like toys that children can just chew on and can actually help to massage their gums. Yes. And then from the time they get all their teeth complete, the toothbrush grid keeps changing. Even though they are interchangeable, there is no direct should I say line drawn as to this age into this age. However, you look for what is more comfortable for the child to bear, and then you stick with it. In terms of braces,
what about in terms of texture?
Okay, so in terms of texture, for a baby to maybe about their first two years, they're about 3 years, it's ideal to use softer toothbrush. The softer the better for them, so they don't get damage to their gums. However, as we get older and our teeth become more established, then we can transit into medium texture toothbrush. Ideally, medium texture toothbrush is universally recommended. However, in occasions, soft toothbrush can be recommended when people have very tender gums that tend to bruise easily.
Speaking of that, just before you get to the next section, there are certain persons in Nigeria, I mean, no pun intended, anybody that wants to, catch their sub should, they believe on brushing till they can feel their spirit and their soul coming out.
Well, if
they don't do that, they don't feel like, they've achieved it. What do you have to say about that?
Well, that is actually absolutely wrong, because when it comes to toothbrushing, the strength isn't what cleans the teeth as much as the technique. So if you practice the ideal technique of brushing and you brush for the appropriate time, most of us want to use the strength and brush within 10 seconds and bye-bye, we'll see you tomorrow. But that is wrong. You should at least brush for about 2 minutes, spending time on each tooth to ensure that it's properly brushed. So you brush the outer surface, the inner surface, and then the chewing surface for the molars. When you do this adequately with medium textured toothbrush and the right amount of toothpaste, it is actually good enough to brush your teeth. Now, when you administer too much strength, what that causes, you end up damaging your gums, you can damage your enamel, which can create severe sensitivity, and then ultimately you realize that you're not even actually brushing well at the end of the day. So I would say to those people, get the right method and leave the strength alone.
Thanks. Now, looking a little bit more at what your organization does, I mean, there's a sensation for the World Oral Health Day. Beyond this day, what are some of the things that DEC does in the aspect of public health?
We actually organize a lot of school programs, so we collaborate with schools to establish oral health programs within. We also work with organizations to have, for instance, some organizations don't have dental insurance. So what do? We come in with subsidized rates to give them a check and to ensure that they get treated for their, for whatever diseases or situations we see established. Aside that, we deal primarily in prevention. Aside the school programs, we're also working with stakeholders in the industry, the ministries, and some private international organizations to create more awareness, to drive up the awareness of oral health, and also to actually reach the most disadvantaged populations.
It is very important to keep yourself clean, to keep your mouth clean. That is the first thing that you have to know. That you have to brush your mouth, you have to keep it clean always, every morning. There's an adage that said that keep yourself clean, keep your mouth clean, and your surrounding. So the first thing you have to know is to keep your mouth clean.
Thank you so much for staying tuned. I'm Ukemere Tukwa, and that was Health Digest World Oral Health Day. Stay with me next time as we bring you more news, more information that concerns your well-being. Stay blessed and not stressed. I'm Ukemere Tukwa. Bye-bye for now.
Ezekiel is 55 years old. He once